Hello. We will get things rolling now. I think most people are seated, so. Good afternoon, and welcome to One Child, Every Child 3MT edition. We are honored to be part of this year's Alumni All-Access programming. Now, Alumni All-Access is an annual celebration for all things UCalgary, open to alumni, their families, and community members. This year, Alumni All-Access includes over 24 in-person events and thought-provoking webinars over 16 days to discover new ideas, explore what UCalgary has to offer, and maybe even spark a new passion. Now, a heartfelt thank you to the UCalgary Alumni Office, including Mortola, Dewadu, and Lee Hurst for their help in making this event possible. Also to the Faculty of Graduate Studies and the Graduate College, especially Kim Suvan, Priya Kaushik, Ariane Jacques for their help. My name is Jamie Roski, and I am one of 4 graduate students from the Cumming School of Medicine who will be sharing our research with you today. Now, first, I would like to go over some housekeeping items for this event for those of us joining us in person. We kindly ask that your cell phones be turned off at this time and for the remainder of the presentations. The bathrooms are located right outside the doors in the top right corner of the lecture theater. In case of an unlikely emergency, please use the doors at the front of the classroom to exit to the nearest muster point, which is located in the HRIC atrium next to the Pure Eatery seating area. Now, before we begin, I would like to acknowledge the land on which we stand today and the Indigenous communities who have stewarded it. This is to recognize their connection and commitment to this land, reflect on Indigenous history, and remind us of our shared responsibility to provide accessible and culturally safe research and healthcare services in Alberta. The University of Calgary, located in the heart of southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The City of Calgary is also home to the Métis Nations of Alberta, Districts 5 and 6. Now, the topic of children's health is near and dear to me as I am a child health researcher. I'm also a UCalgary alum as I completed my neuroscience degree here in 2022. So to all the other UCalgary alum who are watching today, welcome, and we hope you enjoy hearing about some of the latest research that is going on at your alma mater. At this time, I would like to acknowledge a few other departments that contributed to today's event. This includes the Graduate College, which is a hub for transdisciplinary studies, leadership opportunities, and collaboration between UCalgary and the greater community. In addition to the Graduate College, I would like to again acknowledge the Faculty of Graduate Studies, which hosts a graduate competition called the 3-Minute Thesis. All 4 of us who are presenting today honed our presentation skills through this competition, which involved taking often technical information and explaining it in an engaging way through non-specialist language. We would also like to acknowledge the extensive community that comprises UCalgary's One Child, Every Child initiative, as well as the supportive staff from Graduate Science Education. So, without further ado, I would like to tell you about our first presenter today. Now, Heishini Dalpathadou is a graduate of Western University's Bachelor of Medical Sciences program and is currently in the 3rd year of her PhD in medical sciences. Her passion for pediatric research was ignited by her early volunteer work in hospitals and with underprivileged communities, where she saw firsthand the impact of healthcare disparities on children. These experiences inspired her to drive to contribute to improving the health and well-being of children through research. Heishini's PhD project focuses on a condition known as cardiorenal syndrome in the pediatric population, where she investigates the effects of kidney toxins on the heart using heart stem cell-derived heart cells. Under the supervision of Dr. Stephen Greenway and Dr. Andrew Wade, her work aims to improve outcomes and treatments for children affected by this condition. Heishini has presented her research at several local, national, and international conferences. And in fact, she actually just flew in yesterday after presenting at the American Society of Nephrology's Kidney Week, which is the largest international kidney conference, which is super cool. She is also a student lead in the Libin Cardiovascular Institute trainee organization and was a finalist in the 2024 3-minute thesis competition. Beyond her academics, Heishini co-founded 2 initiatives at the Foothills campus, one providing free menstrual products and another offering support to neurodivergent graduate and medical students. Her long-term goal is to bridge bench research with patient care to drive advancements in the health of children with heart conditions. When she's not busy in the lab, Heishini enjoys baking, embroidering, and making science videos on TikTok. So please welcome Heishini Delpathadou.
Every time I walk into the Alberta Children's Hospital, I feel so inspired by all the little lives that are being saved, but also overwhelmingly sad when I see the painful experiences of these children. Last time I was there, I saw a little boy, no more than 5 years old, dwarfed by a dialysis machine which looked like a massive monster next to him. This is life for a child with chronic kidney disease. As if his life isn't hard enough, he also suffers from heart failure. In fact, heart problems are the main cause of death among children with chronic kidney disease. Studies have speculated several causes for the connection between the kidneys and the heart in adults. But what about the kids? Children typically don't have the same heart risk factors that adults do, like high blood pressure. So current treatment guidelines for these kids is based on research that's been conducted in adults. Now, if you're thinking, that doesn't really make any sense, you're right, it doesn't. There are distinct differences between adults and children when it comes to disease causes, symptoms, and treatment. My PhD research seeks to answer these questions. Now, imagine the kidneys like a fish tank with a filter. If the filter isn't working properly, toxins build up and the fish die. Similarly, when the kidneys of a chronic kidney disease patient becomes less efficient, a group of harmful substances called uremic toxins build up in their blood and damage the heart. I want to know which of these toxins are responsible for the heart issues found specifically in children, how much extra toxin accumulates compared to healthy children, and how exactly these toxins affect the heart. So this is where my research comes in. First, I measured levels of these toxins in blood collected from children with chronic kidney disease. This graph highlights the relationship between toxin levels and heart function. As you can see from the dark blue bar, children with healthy hearts had low levels of this toxin. However, in children with heart conditions, the toxin levels spiked, as shown by the orange bar, suggesting a strong link between higher toxin levels and worse heart health. Interestingly, once these heart conditions were treated with medication, the toxin levels dropped back to normal, as indicated by the light blue bar. Similar to this graph, I measured several different toxins in our patient population. This will allow me to create a reference guide that is both relevant and specific to children. But these patients already have the disease. Is it possible to use toxin levels to predict and prevent heart failure before it ruins another childhood? To answer this question, I'm going to take my previous findings and apply them to stem cells. Stem cells are a powerful tool because you can turn them into any cell type you want. I'm turning them into beating heart cells and looking at how these toxins change cell structure, cell function, the health of the cells, and how the cells talk to each other. In this experiment, I took the toxin levels I measured from real patient samples and added those same levels to these lab-grown heart cells that mimic heart cells in the human body. Before the toxin was added, the cells were beating at about 50 beats per minute. But after 24 hours of being exposed to the toxin, the beating rate dropped to about 25 beats per minute. This showed us that these toxins are seriously slowing down the function of these cells, affecting their ability to beat normally over time. I'm doing this work because research often treats kids like little adults, if they're even remembered at all. My findings will benefit the development of treatment guidelines for children, and my methods will provide a preventative, non-invasive indicator of heart issues in kids using a simple routine blood collection. At the end of the day, our goal is to improve the quality of life for affected kids so they can just be kids. Thank you.
Thank you, Heishini. That was fantastic. We have a few questions for you. So first of which, how do you transform stem cells into heart cells?
That's a great question, Jamie. It's a very complicated process, as you can imagine. Before I answer the question, I'll give you a quick analogy. So if you think of the blank pieces in the board game Scrabble, that's pretty much what stem cells are like. You can tell it what you want it to be, and it will be. So in our lab, we take these blank Scrabble pieces and we tell them, you're going to be a heart cell, and that's exactly what we do. So we expose them to specific specific compounds and reagents and environmental conditions that drive them down a path towards becoming a heart cell, which mimics what happens when our bodies are undergoing development. And these cells are very cool because they, over time, start to resemble actual heart cells to the point where they're even beating on their own. And this process is really great because it allows us the opportunity to study heart diseases in a dish, and we have the ability to add toxins and drugs that we can't really do with actual living human patients. So, yeah.
Thank you. Now, what has been the most challenging aspect of your research, and how have you overcome it?
Okay, so this is related to my previous answer because I would say the most challenging part was learning the process of growing these stem cells and transforming them into heart cells. Like I said, it's a very complicated and rigorous process, and these cells are literally like children. They need constant care. If you've seen any of my videos on TikToks, I'm in the lab every single day on the weekends. I don't get any days off. This is because I have to come in and change the media for these cells, which is the nutrient solution that these cells grow in, and it needs to be replenished every 24 hours. And with the stem cells, it's very specific, and also it requires a lot of patience and attention to detail, because if you even make the slightest mistake, everything is just down the drain, and that's months of work wasted. And the other thing too is you can follow the protocol to a T, and stem cells will get very easily contaminated. So very, very sensitive process. And another thing I want to note is wet lab research is not only physically demanding, it's also very mentally exhausting too. It can be disheartening when your cells just randomly die. So over the years, I've learned to tweak and optimize my protocol to the needs of the cells, and also I've built a routine, and I've also learned to be flexible when things don't go as planned.
Thank you. Now, you mentioned that you have built a following on TikTok for your science videos. So how has that platform helped you communicate science to a broader audience?
I think TikTok is a great and amazing digital tool. It has given me the platform to connect with a wide audience ranging from middle school students to professionals in the industry, which has been amazing. And through my TikTok, I've been able to make videos that are a few seconds to a few minutes long and make content that's easy to understand, breaking down complex, jargony science, complex science concepts and experimental techniques into a language that's more simpler and easy to understand. And the other thing with a digital platform is I can reach a younger audience. And through this, I've been able to make science more fun and exciting for the next generation of future scientists. It's been really rewarding to see comments or receive messages from middle and high schoolers, especially young girls, saying how they learned something new or they feel inspired and motivated to pursue a career in science themselves.
Thank you, Heishini. That's really interesting to hear about. I will let you continue to keep the mic so that you can introduce our next speaker, Faith Keister.
Thanks, Jamie. All right, so Faith Keister completed the Bachelor of Health Sciences program, specializing in biomedical sciences here at the University of Calgary in 2022. Through her volunteer and employment positions at the Alberta Children's Hospital, she interacted with preterm infants and their families. Learning about the vulnerability of these infants and the need for evidence to inform best practices inspired her to study preterm infants throughout the entire duration of her undergrad and be the focus of her honors thesis. Eager to continue to advance her knowledge and improve care for preterm infants, she pursued a Master of Science in Community Health Sciences with a specialization in epidemiology with the supervision of Dr. Ayman Abu Meram and Dr. Karen Benzies. She's currently collaborating with the Alberta Collaborative Quality Improvement Strategies trial team across 12 neonatal intensive care units in Alberta. Outside of research, she continues to volunteer as a baby cuddler and works as an emergency department assistant at the Alberta Children's Hospital. She's also passionate about teaching and is a teaching assistant for community health sciences classes and tutors youth in the community. In her free time, she loves to spend time with her family, practice the violin, have chai lattes, and host board game nights with her friends. Please join me in welcoming Faith.
Thank you so much for the introduction, Heishini. Imagine, a baby is born prematurely. They are unable to breathe and feed on their own. They are connected to several wires, tubes, and are too vulnerable to be held by their own family. They may spend several months in the neonatal intensive care units, also known as the NICU, or sadly, may never go home. This is a reality for every 1 in 10 families in Alberta. The majority of preterm infants are born between 32 and 36 weeks of pregnancy, called moderate to late preterm. These infants constitute 43% of all NICU admissions and days spent in the NICU, placing a significant burden on healthcare resources. These infants also have a 9 times greater risk of respiratory illness and 8 times greater risk of experiencing feeding difficulties when compared to term infants. However, these infants are highly underrepresented in research. In 2021, 25,000 moderate and late preterm infants were born in Canada, but only 5,200 were represented in a national neonatal database called the Canadian Neonatal Network. This means only 21% of all moderate to late preterm infants born that year were represented in the annual national reports. As a result, there is a lack of evidence-based clinical practice guidelines to inform the most optimal care for these infants. This has led to variations in practices and inconsistent health outcomes between these infants. To address this gap in knowledge, I am collaborating with neonatologists, pediatricians, respiratory therapists, nurses, and other NICU staff through a provincial-wide clinical trial called the Alberta Collaborative Quality Improvement Strategies Trial. This involves NICUs such as the NICU here at the Foothills Medical Center, the NICU at the Stollery Children's Hospital in Edmonton, and NICUs in rural areas such as Medicine Hat, Grand Prairie, and Red Deer. My master's thesis is investigating the variations across all 12 of these NICUs to identify the practices that correspond to better health outcomes. Using provincial healthcare records, we are collecting data on over 2,500 moderate and late preterm infants to explore the current respiratory and nutritional practices in the NICU. We will then compare clinical practices across all 12 NICUs to identify the practices that correspond to better health outcomes. This can be used to inform clinical care bundles that can be implemented across Alberta and Canada. A care bundle is a set of evidence-informed clinical practices that, when performed reliably and collectively, can result in better health outcomes. The data from the control arm can also be used to inform quality improvement, benchmarking, and future research for moderate and late preterm infants. In summary, here at the University of Calgary, my research is contributing to a new reality where moderate and late preterm infants are receiving the most optimal respiratory and nutritional care because evidence has informed best practices. These infants will have better health outcomes and get to go home sooner. Thank you.
Very exciting research, Faith. Thank you for sharing with us. Now we just have a few questions for you. So, what are the plans after the completion of the control phase?
That is a wonderful question, Heishini. Thank you so much. So as I mentioned, I'm currently collecting data for the control phase to inform clinical care bundles for respiratory and nutritional practices that can be implemented across all 12 of these NICUs. So we're currently in the drafting phases for those care bundles. Once completed and approved, they will be implemented into the neonatal intensive care units in a stepwise fashion over 4 years. So what this means is that every year of the 4 years, there will be a randomization of 3 NICUs for these bundles to be implemented in. And upon the completion of the clinical trial and having the implementation of these practices across all 12 NICUs, we will compare the outcomes and length of stay to the after the implementation to before the implementation, which is the control phase I'm currently collecting data for.
All right. Why are only moderate and late preterm infants included in your study population?
Thank you for the question. So as I mentioned in my presentation, only 21% of all moderate to late preterm infants are currently being represented in the Canadian Neonatal Network reports. And as a comparison, extremely preterm infants, who make up a very small portion of preterm infants, they are currently receiving the most amount of attention in research. For the Canadian National Reports, 85% of all of these extremely preterm infants were represented. And considering that moderate to late preterm infants constitute 85% of all preterm infants, but only 21% are represented, you can see between the comparison that there's quite a discrepancy. And the reason for this is because most moderate to late preterm infants are admitted to level 2 NICUs, where extremely preterm infants are admitted to level 3 NICUs for higher acuity. And most level 2 NICUs are not associated with an institution, whereas level 3 NICUs are, and so they have more funding for research. So as a result, we want to address the gap in research and help promote better outcomes for these infants that are currently not receiving enough attention in research.
And my last question is, how small are preterm infants?
Thank you for your question. Rather than telling you, I'm actually going to show you, and hopefully everyone can see from down here. If not, you're welcome to come at the very end, and I'm happy to show you them closer up and in person. First, starting with the smallest diaper that we find in the neonatal intensive care unit. This is the nano-preemie size. As you can see, very tiny. Following up as the next bigger size is the micro-preemie. Both the micro-preemie and nano-preemie diapers would be for babies around under 32 weeks gestation. The next size here is for the preterm babies that I'm studying, so moderate to late preterm, between 32 and 36 weeks of gestation. And lastly, to compare to a healthy full-term baby born around 40 weeks, This is the size here. So again, if you're having difficulty seeing, you're more than welcome to come at the end, and I'm happy to show you closer up and walk you through them as well.
Perfect. Thank you so much again, Faith, for sharing your research with us. Now I'll pass it over to you to introduce our next speaker, Eliza.
Thank you, Haishini. Eliza Jaffer is a graduate of the Bachelor of Health Sciences program at the University of Calgary and a Chancellor Scholar alumna. She joined the Developmental Neuroimaging Lab at the Alberta Children's Hospital in 2021 as an undergraduate research student, working under the supervision of Dr. Catherine LaBelle and collaborating closely with Dr. Catherine Manning. Eliza's research uses magnetic resonance imaging to investigate brain function and behavior in infants exposed to prenatal distress. Currently, she is a second-year master's student in the Medical Sciences program, specializing in medical imaging, and has been a recipient of several research awards, including the first Canadian Institutes of Health Research Strategic Master's Award. She has also recently published her first author paper in the Journal of American Academy of Child and Adolescent Psychiatry. Eliza has presented her work in both local and international settings. She was selected for an oral talk at one of the largest medical imaging conferences held in London, England, and most recently presented her research at another major research conference hosted in Seoul, Korea, this past June. Beyond her research, Eliza is passionate about enhancing educational opportunities for students. As the Education Co-Director for the Alberta Children's Hospital Research Institute Trainee Association, she co-chaired the Institute's undergraduate research symposium and is actively involved in planning the upcoming trainee symposium in November. Additionally, she has organized educational outreach sessions for elementary students in Calgary Public Schools, inspiring young minds to explore the brain and fostering their enthusiasm for science. She is also an active member for the Graduate Scholar College and was recognized for both the second place finalist and the People's Choice winner for the 2024 3-minute thesis competition this past spring. Outside of her research, she can be found shooting hoops on the basketball court or training for her second triathlon. Incredible. Now please help me welcome Eliza.
Thank you, Faith. Have you ever wondered how the very first moments of our lives shape who we become? Imagine for a moment a tiny seed planted in the most nurturing ground. This seed has the potential to grow into a robust tree, weathering storms and thriving through seasons. But what if, from the very beginning, this nurturing soil was shadowed, not by the physical clouds in the sky, but by the clouds of anxiety and depression? This is not just a story of a small seed, but a metaphor for the earliest stages of human development and the essence of my research. My project aims to understand how a mother's mental health during pregnancy influences the brain and behavioral development of their child. When people experience symptoms of anxiety and depression, the level of cortisol in their body, commonly known as the stress hormone, rises. In pregnant individuals, cortisol can cross the placenta and reach the developing fetus, having implications on the way their brains develop, which can translate to behavioral concerns later on, such as delayed communication. This is especially important as up to 1 in 5 pregnant individuals experience symptoms of anxiety or depression at any given point during pregnancy. This became especially worrisome during the COVID-19 pandemic, where rates of prenatal distress were found to be 3 to 4 times higher compared to pre-pandemic rates, raising concerns about what implications this will have on infant development, but also offering a unique opportunity to study these effects on the child brain. In my project, I leveraged a diverse Canada-wide data set with information from over 10,000 pregnant individuals and their infants during the pandemic. A subset of these infants obtained brain MRI scans at the Alberta Children's Hospital or BC Children's Hospital that I analyzed using advanced imaging software. This allowed me to observe patterns of brain network development across the first 2 years of life. I was particularly interested in the frontoparietal brain network, which involves a group of interconnected brain regions that work together to perform certain functions, such as memory, attention, and decision-making. I found that the developmental trajectories in infants whose mothers had high distress during pregnancy were actually quite similar to those who experienced low distress. In the graph, the high distress group is blue and the low distress group is in green. This may show promising results. However, I also found that infants exposed to higher maternal distress had worse behavior scores in the motor development, social interaction, and problem-solving domains, which then raises concerns later on in development as well. The results of the study can allow us to identify factors that may buffer these effects, such as increased social support from a partner during pregnancy. These results can also allow us to inform healthcare policy and practice by advocating for increased mental health screening during prenatal care visits. Implementing targeted interventions for these children to support their cognitive, emotional, and social development may also be beneficial. That being said, it is important to keep in mind that child development is quite diverse, and that children may respond uniquely to supports, depending on their individual needs, their experiences, and their genetic influences. Ultimately, I hope that my research can help to support healthy development of families, especially during times of elevated and prolonged distress, to ensure that regardless of the clouds above, all children, the seeds of our future, have the chance to flourish. Thank you.
Wonderful job, Eliza, on your presentation. Now to follow up with a few questions. Did you have the opportunity to scan your own participants for your study? And if so, how was that experience for you as a researcher?
Definitely, thank you, Faith. So most of the scans in the study that I described were obtained at the Alberta Children's Hospital in conjunction with a wonderful team of research assistants, lab technicians, nurses, graduate students, and volunteers. We also have collaborators at BC Children's Hospital where we have scanned some infants as well, and have future collaborations at institutes in Toronto and Montreal. So this is great news in terms of neuroimaging data for this study. As a researcher, I think it's very valuable to be involved in the data collection process because instead of just obtaining the scans and analyzing the data, I'm able to look at the intricacies in infant scanning and truly understand the time and the effort that's put into collecting this data. So ultimately, it really gives you a well-rounded understanding of the project and the data set.
Wow, that's amazing. And at what age did you begin scanning the infants in your study? And can you walk us through what this process was like?
Yeah, great question. So the youngest infants in the study were actually 3 months of age. So as you can imagine, they're quite small, but very, very cute. The process of scanning is quite meticulous, but essentially after the participant arrives at the hospital, we take them to the scanner, which at the Alberta Children's Hospital is set up to look like a spaceship. So it's very child-friendly. And if you've ever been in one of the MRI machines before, it does make a lot of loud noises that kind of emulate that as well. And so the infant is then fed and put to sleep. This is natural sleep. We don't use sedation for this study. At this point, they're essentially gently wrapped in what looks like an inflatable blanket, and this helps them stay warm and still during the scan, and then they're fitted with ear protection as well. So at this point, we put them in the scanner and quite literally cross our fingers that they stay asleep, because this would help us obtain the best quality data with low motion. However, of course, this is not always the case, and sometimes the infant will wake up and we'll have to just go in, resettle them, and hope they fall asleep again to continue the scan. So that's definitely really cool. As well, I find it interesting that participants that are in the scanner can also obtain a copy of their brain scan, which is a nice memento to have as well.
And lastly, what do you enjoy most about your day-to-day work on this research?
Definitely, great question. I really enjoy learning how to use neuroimaging software and also new coding programs. But what I really value about this research work is that there's a balance between analyzing data and preparing for presentations and writing papers, but also being able to help with these infant scans and collaborate with some of the colleagues in our lab. I think research in general is quite collaborative, and whether that means, bouncing off new ideas off somebody or troubleshooting code or really just being there to support each other, it makes all the difference and makes this research a lot more enjoyable too.
Thank you so much, Lisa, for telling us about your research. Now I'll hand the mic back over to you to introduce our last speaker, Jamie Roski.
Perfect. Thank you, Faith. Jamie Roski is a joint MSc MD student in the biomedical engineering program, specializing in medical imaging. As an only child, Jamie grew up with little exposure to infants and young children. Looking to gain new skills, Jamie began volunteering at the Alberta Children's Hospital during her undergraduate degree at UCalgary. Her experience volunteering with infants in the neonatal follow-up clinic developed her deep admiration for the resilience of pediatric patients, the strength of their families, and the positive environment cultivated by staff. During her undergrad, Jamie's love of pediatrics motivated her to found and lead multiple child health initiatives in Calgary, including the UCalgary chapter of Heart for Heart, a nonprofit that funds life-saving surgeries for children with congenital heart disease in developing countries. Jamie graduated with her Bachelor's of Science in Neuroscience in 2022 and worked as an administrative clerk at the Alberta Children's Hospital before starting her master's degree. Under supervision of Dr. Catherine LaBelle, Jamie's research uses magnetic resonance imaging, or MRI, to characterize brain development in typically developing children and adolescents. Jamie competed in the 2023 3-minute thesis competition, winning second place and People's Choice Awards. Her research and presentation skills have also been recognized through awards at 6 other UCalgary conferences. As a member of the Leaders in Medicine Physician Scientist Trainee Program, Jamie will start medical school in 2025 after defending her master's thesis. When she's not at the Alberta Children's Hospital, Jamie can be found with her nose buried in a fantasy novel, laser engraving orders for a small business she runs with her partner, or improving her golf game. Please welcome Jamie.
Thank you, Eliza. Now, good afternoon, everyone. I would like to start by asking for a show of hands of who here has ever been a teenager. Okay, shocking. No, that's not too surprising. Now, I'd like you to take a moment and think of a time when you did something risky as a teen. I know I can sure think of a few things I did. Now, I'd like you to raise your hand if, after doing something risky, you were ever reminded, maybe by a concerned parent, that your brain isn't fully developed until your 20s. A few. All right. My master's research at the University of Calgary is working to confirm that this is not just a myth spread by worried parents, but a fact that can be backed up by science. Now, all of our brains in this room today have 2 important regions, the amygdala, which you see in green, and the prefrontal cortex, which is shown in blue. Now, the amygdala is involved in emotional processing, while the prefrontal cortex is critical for complex cognition and decision-making. These 2 regions are connected by white matter tracks, which are kind of like highways that move information through the brain. Now, in fully developed adults, we expect that the amygdala and the prefrontal cortex talk to each other regularly. However, this conversation may be one-sided in the brains of young teens. Now, my research is inspired by the developmental mismatch hypothesis, which is the idea that the amygdala develops before the prefrontal cortex. This might create a critical period during adolescence where teens have a fully developed amygdala that sends a lot of signals to the prefrontal cortex, but a less developed prefrontal cortex that sends fewer signals back. Additionally, the white matter tracts connecting these regions may not be fully developed during adolescence, further limiting communication between the amygdala and the prefrontal cortex. This might explain why teens make risky and emotion-driven decisions. Now, there's also lots of previous literature that shows that females actually engage in less risk-taking behavior that peaks before it does in males. This makes me wonder, does the maturational timing talked about in the developmental mismatch hypothesis appear in both females and males? Now, to answer these questions, I study the development of the amygdala, the prefrontal cortex, and the white matter paths that connect them in typically developing females and males. To do this, I use magnetic resonance imaging, or MRI, to visualize the brains of children and adolescents. So as Eliza alluded to, this can be really tricky, especially with wiggly kiddos who have a lot of energy. So our team at the Alberta Children's Hospital doesn't just put them in an MRI scanner, we actually send them to space using our rocket ship. Using our rocket ship themed MRI, we have obtained over 600 MRI scans from 148 typically developing children and adolescents, ranging in age from 2 all the way up to 17 years of age. Half of my sample is female, and the other half is male. And what I've done is I've measured the structure of the amygdala, the prefrontal cortex, and their connecting white matter tracts in females and males separately. Now, what we see is that in males, the developmental mismatch hypothesis is correct. We see that the amygdala develops from early childhood to late childhood, while the prefrontal cortex undergoes change from childhood all the way towards the end of adolescence. We also see that the white matter tracts connecting these regions develop from 2 all the way up to 17 years of age. What's interesting, though, is that we don't see these same trends in females. In females, we see that the prefrontal cortex and the white matter tracts connecting these regions stop developing before they do in males, which suggests that females actually mature in these regions earlier than males. This might explain why females engage in less risk-taking behavior that peaks before it does in males. Now, my research is exciting and it's important for 2 main reasons. First of which, it can help us understand development. By studying the physical changes that are happening inside of our brain, we can go from viewing our teenage years as unexplainable years of chaos that we would maybe like to forget, to viewing them as a critical and natural period of development where we are learning how to live with adult-like systems beginning to operate inside of our brains. Second, my work can help improve care for children. So while my research looks at typically developing children and adolescents, future work can look at these same regions in those with neurodevelopmental and mental health disorders. This work would help us understand how brain disorders affect brain development and how healthcare professionals can better support children with them. So, I challenge you. The next time that you have a teenager in your life that does something risky, take a breath and remind yourself that their amygdala and prefrontal cortex will catch up to each other, just like ours did. Thank you.
Great presentation, Jamie. We have a couple questions for you today. What are some challenges of scanning infants, children, and adolescents for research?
This is a great question. There are definitely some challenges, and Eliza alluded to these, but I would say that the 2 biggest challenges are probably overcoming fear and dealing with motion. So going inside of this massive scanner that you've never seen before and which makes quite a bit of noise can be really intimidating for kids. So we try and mitigate this through a few different avenues. The first of which is that we make it look like a rocket ship, so hopefully these kids get excited about that. We also have a mock scanner set up at the Alberta Children's Hospital, which can give kids and their families the opportunity to come in, lay down in it, get familiar with what the setup looks like and what the rocket ship looks like. We also have a really cool storybook about Pluto the bear and his trip to space, which we give families the opportunity to read at home before the scan, and sometimes we reiterate once kids come in. Another thing is we give kids the opportunity to watch movies and TV shows inside of the scanner, which is a lot of fun and helps them stay still. And families, particularly parents, can often go in and either lay in the scanner with the kids, depending on their age, or sit nearby and keep a hand on them. So having the parents there, and especially watching the movies and TV, helps deal with both the fear aspect as well as with motion.
So you mentioned that kids can watch TV in the scanner. Very important question. What is the most requested show or movie?
This is the million-dollar question, and I would argue is one of the most exciting parts of scanning is getting to see what kids request. For younger ages, it's got to be Paw Patrol. It's a favorite, and I know more about Chase and Marshall and Ryder and all those folks than I ever thought I would. For some of the older kids, we also get a lot of Frozen, which I know if it was me in there watching it, I would probably be like singing and dancing, but these kids manage to really focus on it when they're in there. And we also get a lot of very specific requests. So a few weeks ago, we had a almost 3-year-old come in and specifically request to watch the Reputation portion of Taylor Swift's Eras Tour movie while he was in the scanner. So it's really fun to see kids get excited about it and enjoy themselves when they're in there.
Amazing. You've shown us today that your research will improve our understanding of brain development and how it influences behavior. What broader implications do you think your work might have?
That is a great question. So I would say that there are 3 main avenues where my work is applicable and I think will be meaningful. The first of which is healthcare. So as I mentioned, future work and specifically even a side project that I'm working on that basically replicates what I've done here in children and adolescents with prenatal alcohol exposure can help us understand how the developmental timing of their brain regions or the brain regions of other atypically developing populations are different. And this can help us both humanize these atypically developing patterns and to open up discussion about it, as well as educate medical professionals on how they can better support these individuals. Another avenue is education. I think it's really important to understand how the brain develops and how that affects behavior. I think that can help education people involved in the education system to better interact with kids and to also empathize with them. And I'd say another kind of third avenue is the justice system. So you might not immediately think about this, but brain development research is actually really critical for educating the judicial system, specifically when it comes to making laws about children and adolescents. So this work and understanding how their brains differ from adults is critical for ensuring they are treated fairly. Thank you.
Thanks so much, Jamie, for sharing your exciting research. I'll hand the mic to Yasher to conclude our event today.
Hello, everyone. My name is Yasser Rahmaniani. I'm a graduate student from School of Architecture, Planning and Landscape, or SAPL. I'm part of the Graduate College as an executive member. My background is all architecture, and I learned a lot because it's very interesting to see a different research from a different background. However, I saw some design and graphic and stuff, which is like, I hope that you can think of like a more transdisciplinary projects in the future with our department or maybe others. That's the role of graduate college. If you're interested in a transdisciplinary research, or at least be connected to others, please come to the Graduate College. But I'm also here on behalf of the Dean of Graduate College, who was unable to be here, Dr. Clifton Cunningham. He also sent his greetings and gratitude for all speakers, Haitian, Jamie, Alyssa, and Faith. Thank you so much. And for Alumni All-Access, and for Peria and Karen from FGS. But if you're graduated and you're alumni, hopefully we are building a new community for senior scholars in the future. So please, if you're interested in that way, also connect Dr. Clifton as well. Thank you so much. Have a wonderful day.
So with that, thank you. That concludes today's event. So thank you guys so much for coming out and for listening and supporting us. We really appreciate it. And the four of us will hang around for a little bit after in case anyone wants to see some really interesting diaper examples. I love this, Faith. That was very original. Or discuss any other questions. Thank you and have a great rest of your day.